Good afternoon, everyone, and welcome to today's press conference for the Friday, the 19th of March, 2021. Today on the panel, and we are live on YouTube as well today, but the recording will be available later for those that wish to watch it back. Today on the panel, we have Lucy Whiteman, our Director of Public Health. We have Deborah Needham, the CEO of Kettering General Hospital. We have Assistant Constable Simon Blatchley from the police. We have Toby Sanders, the Chief Executive of the Northamptonshire CCG, and Dr. Joe Watt, the GP Chair for the CCG. And they will come in the order that I've read them out in, and then we will take questions from the press. I will go straight away to Lucy Whiteman, our Director of Public Health, to run us through this week's figures. Good afternoon, Lucy.
Good afternoon, and thank you, Councillor Morris, for welcoming everybody again. It's good to see so many people still joining us. Obviously, we've had an interesting week. And although we remain in lockdown, as people will see from the headlines, we have actually seen a slight increase in our case numbers compared to last week, which is disappointing. And I have to be honest, it's continued to rise further since the date of the report that this data covers up to the 14th of March. So it really is a cause for concern. And sadly, I feel like a bit of a broken record here, but mixing between households and within households still continues to be, despite it actually being against the current legislation, the cause of transmission locally. We're still seeing high rates in our working age adults, particularly the 30 to 39-year-olds for both males and females. We are understandably seeing an increase in school-age children as well through the new lateral flow device testing. That is not of concern and was fully expected. Obviously, our transmission and that working age population is really the cause for concern here. And although we are seeing obviously vaccination uptake and availability improve, we do still have a varied uptake rate between different groups geographically and around different ethnic backgrounds and cultural beliefs. So again, just taking the opportunity to encourage everybody who is eligible to be taking up that opportunity for vaccination as and when they get the call. It really is going to be one of the key items of our plan that keeps us safe as we start to come out of lockdown. Thank you, Gerald. If we go to that sort of first page of data, as we always do. So, as I said, there's been a small increase in the number of cases. And although, as I said, the data here covers up to the 14th of March, since then, we've seen a continued and in fact, steeper increase in case numbers. So this is really concerning. We could see that the effect of lockdown was working. We were making really positive progress over the last couple of weeks. And then unfortunately, this has now started to really turn itself around and be the complete opposite. We're back up at the top of the list of Chief Medical Officers watch list, absolutely not where we wanted to be again. And we've seen a significant increase in the case rate in the last 7 days up to the most recent data. So going further indeed than this report covers. If we go on to the next slide. So you can see, obviously, we've been in a position where we had obviously gained some ground, but we now are seeing other areas as well as Corby slip backwards. We've not only got a statistically significantly higher rate in Corby as compared to the county rate, but we also have a statistically significantly higher rate as a county again, which is really disappointing, driven by increasing numbers across the piece, but primarily in Corby, Kettering and Wellingborough. So a real challenge, and when you compare those rates that you can see per 100,000 population to the current England average, then you can understand why we are concerned and why we certainly don't want to see any further reduction in the progress that we've been making. If we move on to the next slide. So this is the crude count of cases. Again, you can see quite a jump in those areas that I've referenced before. A small jump in South Northampton. Thankfully, the rate and the case numbers do remain low there, but it does just show that nobody is immune to this. And it really is that sort of complacency as we're seeing, the light at the end of the tunnel for next steps that is going to be our worst enemy over the coming weeks. Yes, we have got vaccinations being rolled out. Yes, we have got lateral flow testing, but community transmission is still rife. We still have a significant proportion of our tests coming back positive for the Kent variant, which is that new, more transmissible variant. And that really is starting to be seen in the numbers where people are starting to let their guard down. So boring as it is, if we do want to continue to progress, we must stick to the rules and really, just apply common sense. If we're out and about, keeping our distance, continuing to wash our hands as frequently as possible, wearing our face coverings where appropriate, and really just trying to make sure that, we're keeping away from areas that we don't need to be attending, still just doing our essential travel and attending work if absolutely necessary, and utilising all of the lateral flow device testing centres that we've now got up and running. We've got 7 now across the county. That's extraordinary coverage for a county our size, as well as testing available through schools for pupils and teachers, through obviously click and collect services for people who are in childcare bubbles, and also through a number of our employers locally. So people really must utilise those services if we're to identify where COVID is, get people isolated, and make sure that we don't see continued increases in our numbers. If we go down to the next slide, please. So this obviously just demonstrates that we've been making really good progress. All of those lines below that centre bar at the 0 point, demonstrating a reduction in our case rates. We talked about that slowing in the last week or so, but clearly we're back up to an increase in this last week. That's obviously not a pattern that we want to continue to follow, and it certainly may have significant consequences if indeed we see continued increases for the county. We do know that the data is driving the decisions around coming out of lockdown, and obviously I'm remaining in close contact with those in central government around what that means locally. We will understand more next week once we've got a bigger picture and we're closer to that next lockdown step, but this is not putting us in a positive position. If we move on to the next slide, please. Again, very easily demonstrated by these lines. The upward tick in a number of them is really concerning, and that deviation back away from both the county and the England average is not good news. We need to make sure that we're tightening our control over what we do, where we go, and who we see. We go down again. So again, we can see the effects of people being at work. We do recognise that people have got increased exposures and some people cannot work from home. But as I've mentioned previously, we need to make sure that they are accessing the lateral flow device testing so that we know who's positive. We know that they need to isolate. We know who to support if they need financial support or any other type of support whilst isolating. But we also know that we need to continue to protect people, even with vaccination and other testing available. People are still vulnerable to COVID, and we still are seeing admissions and sadly deaths. On the next slide, obviously that is case in point, really good progress in as much as we're seeing the number of deaths reduce. But overall, we are still seeing more deaths than we would want in the county. Obviously, Daventry and East Northamptonshire seeing an increase on previous weeks where they'd obviously managed to not have any mortality in that area. So, it is still a challenge. People are still at risk. People are still vulnerable, and we have to all play our part in protecting ourselves and each other. On the next slide, it just demonstrates our position from a point of view of COVID positive inpatients, and I'll let Deborah talk in more detail about that. The following slide just covers the education status, and again, Paul will cover a lot of the detail, but you can see obviously we've made positive progress. Although most of our schools have been open throughout the pandemic, clearly the number of pupils they've been able to or had to facilitate them being back in education has significantly changed in the last couple of weeks, alongside the introduction of that lateral flow device testing, which I'm glad to say a lot of people are engaging with. But I'll leave Paul to cover the detail in this slide. The next 3 slides, as always, cover where we've seen the biggest impact in the last sort of 14 to 28 days. Cases by community, unfortunately, as you will see, focus very much on Corby. So that crude count of numbers in the last 28 days really demonstrating the size of the challenge still in the north of the county. The next slide just shows that obviously by rate, as we've done previously. Again, Corby, Wellingborough, Kettering still dominating the top of that board. And clearly on the next slide as well, you can see the difference between the areas that have seen a reduction in their case rate and unfortunately a growing sea of blue in the areas that have seen an increase in their case rate. So this is obviously something that we need to make sure that we address. And again, you can see in the name there against the rank that this isn't just a Corby issue, but indeed we're seeing other areas have increases as well. So lastly, before I hand over to Toby, if we just have a quick look at the outbreak picture. That is thankfully improving. We've had 8 outbreaks reported to us in the last 28 days. Again, most of those in care settings because of that proactive swabbing. We have obviously picked up some in education settings, and we continue to obviously work with employers and encourage employees who are attending work to do the lateral flow testing so that we can avoid the outbreaks. I think really this just does demonstrate the fact that when people are engaging in regular lateral flow testing, it does allow us to identify that risk early and avoid significant outbreaks, which clearly drive again further community transmission. So really just a plea again for people to utilise the tools that they've got available, take up the vaccine when they're offered it, make sure if they're out and about and working to work regularly that they're accessing testing through either one of the council sites or through their employer, and obviously engaging in testing where it's offered through the schools and the childcare support bubbles. But if I hand over to Toby to cover some of the data around vaccination.
Thank you, Lucy. Cheryl, are you able to bring up the vaccination slides? Thank you. Back one, please. Yeah, there we go. Splendid. Thank you. So good afternoon, everyone. I'm Toby Sanders, the Chief Executive of the Northamptonshire Clinical Commissioning Group. Pleasure to be with you today just to provide an update on where we are in terms of vaccination rollout programme. My GP colleague, Dr. Joanne Watt, will come in to pick up a couple of issues after me in relation to particular aspects at the moment around the AstraZeneca vaccine. But if I just share where we are rollout wise and touch on some of the kind of big issues of this week, of course, and the last couple of days around supply. In terms of vaccination progress so far across the county, a couple of slides with some key numbers here to share. Overall total number of doses administered so far across Northamptonshire, as you can see, 278,000, and the vast majority of those still first doses, over 250,000. And the second doses starting to increase again. You'll recall that they've been sort of fairly stable and flatlined at around 10,000 over previous months, but now we're getting back into the point where people are reaching their 12-week time point. We're starting now to call people back in for second doses, so you'll start to see that number increasingly moving up over the couple of next few weeks. Worth noting, just pausing on this slide, the scale of where we've managed to get to in literally the space of 4 or 5 months. I think if we roll back 5 months ago and thought we'd be having a conversation today about having vaccinated 250,000 people across our county, and with the experience and feedback we get in terms of the relative ease for most people in terms of both accessing and then their experience when they're attending the various sites we've got, I think just worth a big thank you to all of our staff across so many different organisations who've absolutely kind of gone above and beyond in terms of the scale of what we've done in the speed we have so far. And you can see that reflected, Cheryl, next slide please, in where we are in terms of the initial priority cohort groups. So this slide summarises the percentage position in terms of first doses against, or at least first doses against the priority age groups. And you'll see from that we've made tremendously good progress in terms of completion against particularly the over 80s, over 75s and over 70-year-olds. Lucy touched earlier on in her slides on the issue though that we continue to have with reaching out to those what on overall percentage terms might look like small percentages, but actually each one of those percentage areas represents a significant number of people across our county, many in some of the most vulnerable groups, and we are really, really keen to reach out and for people to start coming forward now in those age groups if we've not been able to either get an offer to you so far or you've not been able to come in for your vaccine. We would absolutely encourage people to come forward in those age groups now if we've not been able to reach out and provide that offer to you and follow through on that. Next slide please. So just a couple of kind of big sort of current topical issues. You'll have noticed this week from the national position that the eligibility for the 50 to 54-year-old age group, cohort 9, has now been kind of formally unlocked this week. And I can share actually across Northamptonshire, it wasn't on the previous slide, but already as we're sat here today, we're north of 40% in the 50 to 54-year age group already in terms of first dose vaccinations. And those invitations have started going out across the board now to 50 to 54-year-olds during the course of this week. We've also seen another key milestone this week with the large vaccination centre at Malton Park on Monday of this week. Its 50th day of operation delivered its 50,000th jab, a tremendous testament to the speed and the pace at which that has been rolled out. And in terms of how we are working at the moment to try and reach out, particularly to some of those communities who may not have presented and come forward as quickly in response to their invitations and offers, a number of things that we're doing now to really try and reach out and support those communities, including things like pop-up vaccination services. In fact, today we've got pop-up services operating at Northampton Mosque and also the Islamic Centre following Friday prayers today. I'm really very much appreciative to volunteers from across those local communities for working with our healthcare teams to enable those services to be put on. Going forward, the picture now very much focusing on rolling out second dose vaccinations as well. And worth just probably acknowledging at this point before I bring in Dr. Watt on the kind of AstraZeneca kind of issues of the week. The other big kind of topic, of course, from a vaccine supply point this week has been the announcements on Wednesday around the period we are going into, which will see some significant constraint in terms of supply of vaccines nationally. That will impact on us in Northamptonshire as it will across the rest of the country. It's not going to knock us off track from the original commitments. So, the original commitment around making sure that everybody 50 and over and within the priority cohorts is vaccinated first dose by mid-April. We are still in Northamptonshire, as we are nationally on track for that. And also ensuring that as we go towards the end of July, everyone 18 and over, we will get to those people. But we've all seen and heard the same messages this week from Matt Hancock, the Secretary of State, and from the Prime Minister regarding the April position, and that will impact particularly on first dose delivery across the county. So second doses and those people who are coming back at 12 weeks, we absolutely have that supply confirmed and secure. We will see a significant drop in terms of first dose vaccine into the county in April, and that is very much the reason why we're keen to use that period during April to concentrate on reaching out to as many people as we can who are still within those first 9 priority groups in the 50 and over groups. And it's worth noting we do still have availability, including next week at the large vaccination centre at Moulton Park, over 1,000 slots still available there for booking. So if you're watching or listening to this and you've received your invite and you've got access to the national booking system, please do use it, please do take it up, because this is the best way to protect ourselves and the best way to help manage our way through this. I'll bring Dr. Watt in briefly, if I may, at that point. Councillor Morris, just a touch at this stage on the issues around AstraZeneca, which have also been topical during the course of this week. Thank you.
Absolutely. Dr. Watt.
Thank you. We know that people worry. People worry about vaccination, but they also worry about the disease itself. And at this point, we are confident that the AstraZeneca is safe. It is recommended by the MHRA, and the reports of people getting clots are actually much lower than people would have just generally through their everyday lives. So it's not an area that worries me. I am happy to recommend the vaccines that we have available. They are good vaccines. They are tested. And I think what I would say to people is if you've been thinking about it and you're not sure and you just wanted to hear a bit more about it, this is a good time to go ahead and book it. Even if you need to change your mind and you previously said, I don't think I want it, you can still change your mind. It is an offer that continues to be there. And this is a good time to go ahead and book it, particularly if you're in one of the clinically extremely vulnerable or the clinically vulnerable groups. It is really important that you get your vaccination. Please remember that you don't get protection straight away. It will be up to 3 weeks before you get that protection from it, and you do need to complete the course and go to the same place for the second jab as you go to the first. So do think about that when you book your appointment. It is really common to get an achy arm, feeling a bit under the weather, a bit fluey. Those are really common things, but they are a lot better than the serious form of COVID that some of our population have unfortunately suffered with. And so what I would say is that the side effects are mild. The condition is well worth preventing against, and very much emphasise all the things that Lucy has been saying. Get tested, get vaccinated, get back to normal has to be the message. But we have to do all of those things, and we have to continue to protect ourselves even after we've been vaccinated. Continue to take the precautions and keep those around you safe.
Thank you very much, Joe, Toby and Lucy. Some really interesting stats there, particularly around the vaccination. I've actually booked myself into Moulton Park next Tuesday, and it was a very, very simple process done online with very little information required other than your national health number or your NHS number, and things like that. And also have a date for the second one later in June. So I will be going there and definitely taking the vaccine. I don't think there's any doubt in my mind that that is not the right thing to do, and I would recommend everyone else to go and do it as well. And Lucy, thank you for the run through of the figures. Slight concern over some of the raised numbers there, but we are aware of the situation and working very hard to do what we can to bring those down. I'm going to bring in Deborah Needham now, who's the CEO of Kettering General Hospital. Hello, Deborah. Good afternoon.
Good afternoon, Councillor Morris, and good afternoon, everybody. So we continue to see a steady improvement in the number of our inpatients with COVID across both of our hospitals. Today, we have got 60 inpatients. 5 of those are in ITU. It's welcome news, to be honest, and just reflects the huge effort and sacrifice put in by so many people, so many of us during the lockdown, which we know has protected ourselves, our friends and family, and of course it's protected the NHS and our hospitals. So I think we've got to remember, as we move towards the easing of the restrictions, COVID is still out there in the community. We've seen from the previous slides the increase in some areas, and if we don't stick to the rules and the guidelines, it will continue to spread. Now, earlier on in the pandemic, we took quite a difficult decision across both organisations to restrict visiting. That was in line with national guidance, and I appreciate that this has been really difficult for patients and their loved ones, but it has kept our patients and our staff safe, and it's reduced the chances of somebody bringing in the infection, the virus, into our hospitals. So we still need to maintain safety, but we are now reviewing the government guidance, and I am very much looking forward to a less restricted visiting plan in the next few weeks. I recognise the anxiety and distress of not being able to see family and loved ones. It's the same for all of us if there's somebody in hospital. But we have introduced a range of measures, including smartphones, tablets on our wards, so that patients could have virtual visiting. And of course, we've got drop-off points so that any personal items can be passed across to patients should they need anything from home. So more to come on visiting restrictions over the next few weeks, but if you need to know now what our restrictions are, you can go on to both Kettering General and Northampton General Hospitals websites. So I think we just need to continue to do everything that we possibly can. Make sure that you have the vaccine. We've heard that from Lucy and Toby this afternoon. We've got slots available. Please, if you're eligible, get booked in for that vaccine. We need to maintain good hand hygiene still. Make sure that you're wearing a mask or a face covering, and make sure that you're maintaining social distancing. We, of course, have still got quite a long way to go. We can't let our guard down. We can't let our guard down too soon. If we do, numbers could easily rise again. And of course, if that starts to happen, it will inevitably lead to more hospital admissions, increases in deaths, etc. So a plea really to the public, please do not let your guard down. Now, I think we've previously spoken about outpatients and operations, and I think the public are aware that we had taken some routine outpatient activity and routine operating down. We'd paused quite a lot. We're now starting to undertake some more of our routine activity. But I think what's important here is just to let the public know that recovery will be slow. And what's important here is that we restart slowly to make sure that the patients that we are treating are safe, and we are doing this safely. Therefore, my take-home message here on routine activity is that it's going to take a significant amount of time to recover and to reduce our waiting times back to the national targets. So I'll stop there and obviously take questions at the end. Thank you.
Thank you very much, Deborah. I think the key message is hands, face, space, and test, 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 I think is probably what I would add to what you said there very eloquently, as always. We're going to come to the questions in a minute from the press. Oh no, sorry, I've got Simon Blatchley. I do apologise, Simon. Assistant Chief Constable Simon Blatchley. Before I bring you in, I just wanted to let you know that we've also got Paul Andrews here from the school cell, Councillor Tom Beattie, for the leader of Corby Borough Council, Councillor Martin Griffiths, the leader of Wellingborough Borough Council, and Councillor Jonathan Nunn from Northamptonshire Borough Council. I was very remiss not to mention them at the top. Apologies, and they're here to answer some of your questions as well. But I will come back now to Simon Blatchley. Apologies, Simon, I nearly missed you out there, getting trigger happy with the running order. I do apologise, Simon.
No, thank you, Councillor. Good afternoon, everyone. Just echoing the comments that have previously been made. From a policing perspective, we've continued to enforce where necessary. We're still getting calls from the public. Firstly, I'd like to just say thank you to people such as wanting to hold vigils for Sarah Everard, and also some of the community that wanted to hold litter gathering and things like that. Generally, we've seen some really good compliance, negotiating with the police, and people have found other ways to do things, which is really good to see. And I'd encourage that. You know, we are coming to the next phase of this lockdown on the 29th of March, so we really do need to continue as we're going. Similar to as Lucy outlined, what we're seeing as the police is it's those gatherings, both in households and outside, where members of the public are calling us, we're attending, and then we're then issuing fixed penalty notices. There's clearly no explanation for why you get sort of 8-10 people from different households all meeting in one place, so we are enforcing. With the knowledge of the increased rates in Corby, working with partners, we have, as always, put additional patrols into Corby. We'll be doing so over the weekend as well, working with wardens, working with environmental health officers, both looking at businesses and also those social gatherings as well. So really, it's please encouraging people to follow the rules so we can try and get that rate down and we can come out of lockdown safely. And as for vaccinations, I'm one of the lucky ones that has been jabbed, being a man of a certain age. A little bit of a sore arm, a bit achy the next day, but fit and well, and an excellent process down at Malton. So thank you to everybody involved in that. Thank you, Councillor.
Thank you very much, Simon. As always, it's good to know that you've got our backs in the county in terms of enforcement. As always, as with everyone on the call, everyone on the panel doing an amazing job on behalf of our county, I think it's fair to say. I'm going to come to the questions now. So first up, I've got Stuart Ratcliffe from BBC Look East. Hello, Stuart. How are you?
Hello, I'm very well, thank you. My first question was just to ask about Corby. A few weeks ago, I was chatting to Tom Pursglove, and he was talking about, when the rates were much higher, the possibility of a task force coming into Corby. That didn't happen. As rates are going up again, is that something that's perhaps being reconsidered? And then my second question was, we heard about the concerns there about the AstraZeneca vaccine. Have we seen any hard evidence of people not showing up for appointments, or perhaps showing up and then not wanting the AstraZeneca and wanting the Pfizer? Have we seen a downturn in people taking the AstraZeneca vaccine at any of our hubs?
Thank you very much for those questions, Stuart. I will bring in Tom Beattie first on the Corby question, and then perhaps Lucy will come in after that, and then I will come to possibly Toby and or Joe. Well, possibly Joe first, then Toby on the second part of your question. So thank you very much. I'll come to Tom first. Tom.
Yeah, thank you, Ian, and thanks for the question, Stuart. You said that the task force visit didn't happen. It did in fact happen. It wasn't a visit as such. There's no physical task force which came to Corby, but there were a series of meetings with cabinet task force members a number of weeks ago. So I think the call for another task force, if that's what's being asked for, probably isn't realistic. I don't think things have changed hugely since the information gathering exercise, which it was, took place back whenever it was. We're talking probably about 2 months or so ago, and I think that was in response to the, if you recall, in response to the letter that I had written to the Prime Minister expressing concern about the level of industrial activity in Corby and what constituted essential and non-essential manufacturing. I think the evidence we gave to that task force meeting has informed some of the things that we've done since then. At the time, what we need to do is continue to follow that advice, and we are doing that. You know, we're continuing here in Corby and across the county in delivering those messages which we've been putting out regularly about you know, hand, space, and face, and all of the things about social distancing and safe behaviour. I think it's important that we continue to reiterate those messages as we begin to emerge from the lockdown. We've already saw some small loosening of lockdown regulations that will continue. I think there's inevitability, I suppose, that increases risk. We've seen schools opening up recently, and we've yet to see what the impact of that might be. But certainly the government and the Cabinet Office Task Force that you refer to are aware and have been made aware of the issues that we see in Corby, in the whole of Northamptonshire, but specifically from my point of view, the concerns that I expressed to them about Corby. Thank you.
Thank you very much, Tom. I'll bring in Lucy Whiteman now to comment on that question as well, and then we'll come to Joe and Toby on the second part. So Lucy, are you?
Thank you, Councillor Morris. I've just actually checked the diary, Tom. It was the 20th and 21st of January that the meetings took place with the Cabinet Office, off the back of actually a letter that you wrote raising your concerns about the level of exposure that all areas have where working from home is just not possible. And as outlined in that letter, and still exists today, and is certainly still a significant contributory factor to the continued transmission in Corby. We've got a much higher proportion of the population living there and in other areas in the north, in roles that they just cannot simply do from home. And therefore, when you're backwards and forwards to work, no matter how secure the setting, where you're stopping for petrol, you're having to arrange childcare, you're potentially using different childcare bubbles dependent on your circumstances. You've obviously, every contact that you have with somebody else poses a risk to you and to them, and that's why we're seeing that continued community transmission. We've seen it in other areas with similar demographics. You know, Northwest Leicestershire is one area that is continuously having similar issues. Leicester City obviously is one of the areas that had that kind of initial issue and continues to have today. So we do recognise, and it is known that, you know, areas with high manual working, areas with higher deprivation, etc., do tend to have you know, continued and consistent and quite challenging community transmission. So, you know, that is one of the things, as you say, that we spoke at length about with the Cabinet Office when they visited back in January. At this point in time, you know, we know the issues, they are the same issues. Some policy is changing to support that at a national level with things like the introduction of workplace testing that is centrally managed. We've obviously provided local testing arrangements to try and mitigate that risk. But there is nothing new here that is causing this issue, and our challenge continues to be complacency, and obviously making sure that people do, whenever they possibly can, limit things like visits to, you know, shops, visits to other areas, and visits to work if indeed they can. So yeah, I don't see that it would add value at this point in time. The policy issues we raised continue to be challenging, and are being addressed locally where we can and nationally where they're able to as well.
Thank you very much for that, Lucy and Tom. I'll come to Dr. Watt on the suspension of the AZ vaccine. I know you've probably already referred to it, but it's probably worth reiterating the safety of the vaccination programme. And then obviously, Toby, if you wish to comment as well, I'll bring you in. So Dr. Joe Watt first.
Absolutely. So in this country, we are guided by the MHRA with regard to the safety. We do not have any concerns about the safety in this country, particularly with regard to the scale-back clocks. This is safe for us to continue to do. Absolutely would encourage people to continue to get their vaccines. We have seen some people who get who are a little bit confused about the way they're being called, and may try to book more than one appointment and not understand the booking system. And it's important that people know that they have a choice. But equally, if people aren't able to attend their appointment, we do want them to free up that appointment for someone else. We haven't seen significant amounts more hesitancy. People are asking more questions. They need to build their confidence. There's lots of really good information around. The County Council website is a fantastic source of information. The NHS websites are really useful as well. but this is a safe vaccine. It is good to use. It will give you protection. Doesn't stop you from needing to do all the other things as well. But this is a safe vaccine, and we know that as people have more and more of their friends, family, and those of us that have had that vaccine successfully, it will allow people to build confidence and to get the protection they need. And as I say, particularly the vulnerable groups, I would absolutely urge them to get protection, get your vaccine in, go ahead and book your appointment. But I don't have any concerns about the safety of this. This is really, really important that we do this.
Thank you. Toby, did you want to comment on that question? I expect you did.
Well, just to I mean, Joe's covered it well in terms of the kind of safety in view. From the aspect of the question around, are we seeing a significant impact in terms of people either not attending or attending and then deciding not to go ahead? But we're not. That's not something that's coming forward so far in a significant way. That's not to say there won't be people, as Dr. Watt has said, who won't be considering and reflecting a bit more on this. But we're not seeing that present at the moment, thankfully. And I really hope it stays that way, because I really hope that some of the anxieties and concerns from a European perspective don't impact on uptake locally, because this absolutely remains our way through this, and there's clinical consensus in terms of that from a UK perspective. So let's hope it stays that way.
Thank you very much, Toby and Joe. Thank you for that question, Stuart.
Thank you.
Thank you. I'll move now to Matt Harris, from Northamptonshire Live. Matt, are you there?
Yeah, hi guys.
Hi, good afternoon.
Good afternoon. So my first question was, I saw on the slide earlier that there was one outbreak reported in Corby where 8 people caught coronavirus. I just wanted to ask, now that non-key worker children are allowed back in schools, is there a concern for more outbreaks happening in schools? And I'd also like to ask, how big would the outbreak have to be for a school to fully close?
Thank you very much for those questions. I think that's a 2-part question. So if I may, I'll bring in Paul Andrews, who's our school sales lead, to talk about the outbreaks in schools, etc., and closing of schools. And then I might bring in Lucy to talk about the outbreak in Corby, if as I understand it from your first question, unless Paul deals with that in his answer. Paul.
Thank you, Councillor Morris. Good afternoon, everyone. Thanks for the question, Matt. Outbreaks in schools are they're very context specific. So it's the absolute number is never the driving matter in terms of whether a school might need to close or not. Sometimes a setting will close because they haven't got the numbers of staff to remain safely open, and that's a matter for the head teacher. Just from memory, and Lucy might correct me, but I can't remember that we've yet had to close a school because of an outbreak of COVID. You know, sometimes schools have closed because they haven't got the staff to remain open safely, but we've not had to close a school because we're worried about the outbreak spilling out of control. And that's the main point I'd want to make, is that if we do get an outbreak in school, we work closely with that school. We look at the reasons behind that outbreak. We look at the actions that they've taken, and we see what we can do to support them to contain that outbreak. And almost universally, schools have worked incredibly hard to stay COVID secure. And the issue very often is not within the school. This is infection brought, as Lucy has alluded to earlier, from outside of school. And I think I would take this opportunity to make a plea to parents to, please do your bit. Please, when you're traveling to and from school, remain socially distanced. Do not walk with other families. Do not allow your children to mix. Wear a mask outside the gate of the school. Please show a good example to your children, because if you don't do that, especially in areas like Corby, where the infection rates are higher than we would like, the risk of infection coming into school is very real. And we really want our children to have the opportunity to be back in learning and undisrupted learning. I'll just refer you, I guess, as a second part of this answer. Outbreaks are only one measure, and they're not a very good measure of the level of infection that we see within school. So if you look at the slide that we've introduced, there's a 7-day rolling average. And what you'll see from that, you can clearly see the introduction of everyone moving back into school, and also the introduction of lateral flow device testing in secondary schools and amongst staff, pushing up the rates. but you can also see that that has started to plateau. And so I think we'll keep an eye on that. But generally, I think it's gone very well and we're happy with the return. That's not to say we're out of the woods, because we're not out of the woods, and we will get outbreaks. I'm not going to sit here and pretend we won't get outbreaks. We will get outbreaks, but we're well set up to deal with those. Hopefully that's answered that. If not, I'm happy to take a follow-on.
Thank you very much for that, Paul. Sorry, Matt, could you repeat your first question? Because I was going to bring in Lucy on the schools, but I didn't quite hear your first question. I do apologise, other than the one about schools.
No problem. It was essentially whether or not you thought non-key worker children coming back into schools would provide like a higher chance of an outbreak, but I think Paul kind of answered that one.
He did. Thank you very much. Lucy, did you want to comment on the questions at all? No, thank you. Thank you very much, Matt, for your question.
I just have one more question. Sorry. A professor of nursing who lives in Corby has raised concerns about the town's supermarkets, saying that their enforcement of PPE and social distancing is not as good as it was in lockdowns 1 and 2, and maybe one of the reasons for the problems with the town that it's obviously having with COVID. What are your guys' views on this?
Thank you for that question. I'm going to bring in Dr. Jo Watt because she has knowledge of both supermarkets and the area in question. So I'll bring in Dr. Jo. Jo.
Yeah, so I have a life outside being a GP as well. So as somebody who has visited Corby supermarkets, I think people are trying their best, but I think you still see people shopping as family groups. And to use one of Lucy's phrases, just because you can doesn't mean you should. So it may be within the rules, but I would still encourage people to shop alone where you can. It gives more space for people to move around. There's a lot less congestion. People aren't better at wearing masks, but certainly at busy times, if people go shopping in family groups, it is going to cause more congestion within the supermarkets. I know that most people in Corby are trying really hard, but I think it is important for people to stay vigilant, not to relax. The natural tendency in Corby is to be really friendly and actually just give it a little bit longer. Contact your friends and family, but not in person. And we will get back to normal eventually. But at this point, please do stick to the rules. Please do stay away from those people that you love in the physical sense, but keep talking. Keep up with your mental health. It's really important to talk to people, but not to spend time physically with the people that you love, because unfortunately that is how the infection gets spread.
Thank you, Jo, as always. And Matt, thank you for those questions. Some good questions there. Thank you so much. I'm going to move on now to Alison Bagley from Northamptonshire Telegraph. Alison, hi.
Good afternoon. Hello. Yeah, I've got two questions. I think my third one was already answered. Would you support a total lockdown for Corby? With most Corby schools off for a fortnight at Easter, would you welcome a complete shutdown of workplaces and even a possible curfew to prevent mixing of households? A kind of short, sharp shock approach. And if cases continue to rise as the two Unit 3 authorities are formed, can you foresee the first major issue facing Northamptonshire, that it might remain in lockdown with surrounding areas having restrictions eased?
Thank you, Alison, for those questions. I'm going to come first on the specific question about Corby to Tom Beattie, and then I might come to Lucy as well. And then in your second part question, I'm probably going to bring in Martin Griffiths and Jonathan Nunn on that one. So we'll start with Tom Beattie. Tom.
Yeah, thank you, Ian, and thanks, Alison, for the question. I mean, I understand the sort of almost a desire to do something more than what we're already doing to try and address the issues here in Corby. I think that would be very difficult. I think we've been in lockdown now for a long time. We've been in a series of lockdowns. People are suffering from lockdown fatigue. I think there's probably also an element of complacency which has set in because of the success actually of the vaccination program. So maybe people have relaxed in a way that they shouldn't have. I mean, as far as a total workplace shutdown, I've never called for that. What I did call for was, let's identify what is considered to be essential and non-essential work, and maybe people who are unable to work from home could be supported by working from home if they're in non-essential manufacturing. A lot of which, of course, there is in Corby. Corby is a town with a high manufacturing sector and a lot of people who work in warehouses and distribution. So their ability to work from home, as been said earlier, is extremely difficult. So I think it's trying to get it right. I think a complete lockdown with a curfew would have an extremely negative effect on public morale. I think it would have a negative effect on people's mental health also. I think what we need to continue to do is to say, look, we have measures in place. If we abide by the measures in place, we will get out of this. Now, you know, we've been saying that for a while. We have seen a reduction, you know, from the high points back in early January. That's come down. It hasn't come down in Corby as quickly as we would have wanted. And the recent upward spike is a concern, as Lucy indicated earlier on. But I'm not sure that requires that sort of draconian measure of a complete lockdown and curfew, because that brings with it other consequences which could be equally as damaging to public health and public morale. Thank you.
Thank you very much, Tom. Lucy, did you want to comment on that question? I think Tom very ably answered that one. So I don't think you need to comment unless you feel you wish to. Thank you very much. So the second part of your question is, I'm going to bring in Jonathan Nunn and then Martin Griffiths and then maybe Lucy if she feels the need to comment further. So I'll bring in Jonathan Nunn first. Hi, Jonathan.
Hi, Ian. Afternoon, everybody. I think what you're referring to here is the question of if the cases continue to rise as the unitary authorities are formed, do we foresee that the first major issue facing Northampton is it may remain in lockdown? There'll be a sort of professional answer to that as well. We're not entirely sure whether there's going to be these risks of further localised lockdowns, but perhaps the bit I can deal with is reassurance on the continuity. The COVID response, albeit we're making progress, remains the highest priority for all local government across Northamptonshire, both in the west and the north. And what you see here as a joint effort will continue throughout that time until we've completely beaten it, really. I think we've seen probably the greatest pulling together of public services across councils, districts and boroughs as we move into unitary, along with the health services, police and others, really. So really the best I can do is make an assurance. I suppose the nearest I'd come to any kind of professional medical opinion would be to continue to say, as we have done for a year now, that we're not out of the woods and that we need to keep up the precautions. There are still people getting very ill. There are still people dying. I would recognise, although it's a little while since I've been able to get over to Corby, I'd recognise that supermarket point in Northampton to some degree. I see variations in the level of standard. I see people shopping as a leisure experience, and I see supermarkets slightly dropping the ball, if I may, on their sanitising facilities and so on, which at different times have been far stronger, I would say. And I would urge we obviously environmental health continue to talk with supermarkets and encourage them, but may I separately encourage all supermarkets to really keep the standard of those things up, because we don't want to drag this out as something painful. We want to get it finished, and I do think it's one of the key ways in which many people mix with anybody each week is their weekly shop. So don't go in groups, please. Make sure you keep your mask on, sanitize your hands, and supermarkets, please, really up the game if you could on the precautions. Thank you, Ian.
Thank you very much, Jonathan, as always. I'm going to bring in Martin Griffiths now. Hi, Martin.
Thank you, Ian. And as Jonathan said, COVID-19 remains the #1 priority issue for both of the new unitary authorities. And most residents will not notice a significant difference from the 1st of April vesting day. What we want is a seamless transition for our residents as we continue with a planned and strategic transformation of services over a period of time. We all need to learn from the rates in Corby, being higher than the national rates compared to other parts of the country. And just a general comment, if I may, Chairman, while I've got the mic, is the way that we ensure that Northamptonshire and its residents have a better summer is for everyone to adhere to the rules and remain vigilant this spring and Easter, and to not mix with other households. Just a general comment, if I may. Thank you.
Thank you very much. I'll bring in Lucy Whiteman as well to comment on that one.
So I think it's just worth mentioning as well, because people may not have appreciated this, that behind the scenes, although we've been creating 2U unitaries, and as I said, and you know, everybody has said that you will not, as a service user of any of those services, hopefully recognise any difference. We have, to ensure continuity, kept the public health team as one that will be hosted in Northamptonshire Council, and the emergency planning team, which obviously we work alongside very closely with regard to providing the wardens, coordinating work with the police, making sure that we've got locations to undertake vaccinations, for example, but also the lateral flow testing. So in order to ensure that there is no disruption to the team who's obviously leading on a lot of the response actions, indeed the council have agreed for that service to remain as one for the foreseeable future, certainly for the first year of the unitary arrangements. So just want to assure people again, for lots of reasons, that we will continue to work together and make sure that this remains the priority as we go through that transition period in the next month.
Thank you very much, Lucy, and thank you for those questions, Alison. Good questions, and thank you for the answers. Excuse me. I'm going to move on now to Kevin Nichols from the Chronicle and Echo. Good afternoon, Kevin. I do feel I do feel we've answered the first one probably, but if you wanted to.
Actually, I was going to prefer to ask the first one rather than the second one, if that's all right. Okay. I appreciate you running from time. I just wanted to know regarding the NHS letter that came out warning of the supply shortages of vaccine. What did that come to as something of a surprise to the people in charge of the rollout here? And also just how many people in Northamptonshire, if you got a ballpark figure of how many people that might have their jabs delayed because of that?
It's a very good question, Kevin. I'm going to bring in Toby Sanders on that one. Toby.
Yeah, thank you, Councillor Morris, and thank you, Kevin, for the question. So to your first part of that, in terms of when we were cited on kind of those announcements that became public on Wednesday, my team have regular daily conversations with NHS England's team nationally and regionally, and that's been the case through the whole of the vaccination programme over the last 4 or 5 months. So there's very, very frequent conversations and contact. We were aware of the content of the letter before that was formally issued on Wednesday during the course of the day, and I was personally involved in national briefing sessions with Simon Stevens, the Chief Executive of NHS, and other national colleagues. I think Dr. Watt, you were also involved in one of those during the course of Wednesday as well. So we have a very, very regular and frequent flow of information and communication on those sorts of issues, and we've always had, as we've been through the vaccination rollout, variations as we've gone through the course of that in terms of supply. So that's something we get notified on pretty much on a weekly basis as well. So I hope that deals with the kind of first part of the question. To the second part, in terms of, I think you phrased it as the number of people that might have jabs delayed. So it's pretty important to remember that the vaccination programme is actually on target and on track with the commitments that were originally set out. So the commitment around all over 50s and the extremely vulnerable groups being vaccinated by the middle of April is something we're absolutely still on track with. And on the basis of our current understanding around future supply, we also expect to still be in a position to deliver on the all adults over 18 by the end of July commitment as well. So in a sense, we're in one of those positions where we've actually had a bump a couple of weeks because we had vaccine supply pretty significantly increased over the last couple of weeks. It does mean we will see a slowdown during April in terms of first doses, and that does mean that we won't be progressing at this point more quickly through the age cohorts, particularly going below the age of 50, but it will give us that opportunity to concentrate on second doses and making sure we're honouring those, and also making sure we're reaching out to all of those people that still might be out there in the 50 and over and the priority groups as well. So I wouldn't phrase it from my perspective, Kevin, as a people being delayed, or from that perspective we are still on track with the commitments, but it does mean that we'll be reprioritising that back, and it will be kind of April onwards. I would imagine that those folk who are in the under 50 age groups are going to expect to start getting called. Thank you.
Thank you very much, Toby, and thank you for that question, Kevin.
Thank you.
Thank you very much. We're running. We've still got a bit of time, but I'm going to bring in Martin Heath now from BBC Radio Northampton. and you had about 4 or 5 questions, but I do feel we may have answered pretty much all of those. I don't. So I want to give you a chance to ask another question if you are happy to do so, Martin.
I don't think we've covered the one about whether we've had incidents of particularly bad side effects or reactions in this county, whether anybody's, I mean, everybody's talking about, you know, the slightly painful arm and that sort of thing, but have there been incidents of anything more significant in terms of side effects? I think that's one that hasn't been covered.
No, you're probably right, Martin. I do apologise. I didn't mean to be disingenuous to your question. So I'll bring in Dr. Joe Watt to talk about that specifically. Thank you, Joe.
So we've not had significant side effects. We've seen the same sorts of things that would happen with any vaccination programme, but it hasn't been a significant issue here. Minor aches, pains, the odd faint. Other than that, this has not been a significant issue for us in the county. We've taken all the precautions. All of the vaccination sites are fully trained should anything happen, but it hasn't been a significant issue for people locally. So not something that worries us enormously, and we keep a really, really close eye on everything that happens. And obviously some of these people will have other illnesses and things that go on at the same time, but from a pure vaccination related point of view, it's not a significant issue for us.
Thank you, Joe, and excuse me, thank you, Martin, for that question. I think that is all the questions done for today. So we are slightly running 1 minute. We've got about a minute or so. If somebody was to shove their hand up, blue hand up very quickly, they could ask one more question before we go. I'm just going to see if anyone's doing that. Otherwise, I will close the meeting. This is in fact the last press conference that I will be hosting, because I believe we go into Purda from next week. Am I right, Lucy? Are you going to?
Yeah, and I wanted to just try and squeeze in at the end the opportunity to say thank you so much, not just to you, obviously, for hosting and doing such a superb job. I'm sure your future definitely is going to be on the stage more so than it is in politics, perhaps. But also to all of the other councillors who clearly also will be having to gracefully bow out for a couple of weeks at least. You know, your contribution and your insights and your leadership, in fact, in delivering some of these messages has been, I think, pivotal to the success that we've had. You know, clearly, as we can see from the data at the moment, that the battle's not over in Northamptonshire. You know, there still is a war raging, and we do still need to continue to play our part and soldier on. But there is a light at the end of the tunnel. I just want to thank you all for your contributions to this. I think it's been really helpful. Personally, I find these a really good exercise, and I hope that obviously our media colleagues as well have continued to find them helpful. But yes, thank you very much. And yeah, we hopefully will see the other side, but we'll recognise that politics is a fickle mistress, so we'll see what happens over the next few weeks. But thank you.
I mean, personally, I think they've been an extremely good sign of cooperation across the entire county, across all parties and, you know, all bodies, and it's been really amazing to see, and has helped, I think, to cement the future of the North and the West as well, in terms of future workings and all the rest of it. So I would just like to say thank you very much to everyone who's attended today, and thank you as always to our friends from the press for their questions. Stay safe and well, and no doubt we'll see you again soon, somewhere in some other iteration. You never know. I'll say goodbye and have a lovely weekend, everyone.
Thank you very much.